So Joyce, are you happy with your decision to get the multifocal lens implanted?
I am. It was a great decision. I wore glasses ever since I was in the 3rd grade and interspersed contacts in between, but get tired of them, wear them for a while and have an infection or something. So it was just a great freedom that I experienced. The next morning after my surgery, I woke up and looked out my kitchen window and Lord, I thought I could see 2 blocks. I could see houses across the golf course that I live on that I didn't even really knew were there.
That's good, very good. How often do you wear glasses now that you've had your lens implanted?
I never do other than sunglasses. Yeah, it's like was a completely new thing. It was a hard habit to break, reaching for my glasses, because I'd done it my whole life basically, other than spurts with contacts.
Are you satisfied with your near vision?
Yes, yes, I can read tiny little things, little packets, like this little packet.
If I give you this, would you mind reading some of the
So
small print on it?
we just gave Joyce a small the Splenda packet, and we're going to see if she can read the smallest print on it.
Yes, it's a serving size, 1 packet, amount per serving, calories 0, fat 0, total fat 0.
That's great. That's great.
And it's teeny.
And it's teeny. And so, Joyce, what about driving?
I have no trouble with driving. I can see fine. Had a little bit of haloing, and I actually think that's getting
Better. Yeah, there's always an
Over
adjustment
time.
period, and
Yeah.
things tend to improve.
So that's fine, and hasn't been a problem when I do drive at night. So
Now, prior to surgery, you were extremely nearsighted, and
Yes.
I mean, you just could not function without glasses at all.
Couldn't.
So, it must have been a huge change to go from glasses all the time to glasses none of the time.
never. It is. It was a tremendous change. I mean, like I catch myself when I go to bed reaching to take my glasses off because it was so habitual that it seems funny. And sometimes even now, months later, I still catch myself doing that. So I would, I just go get up and start tearing around and never think about grabbing a pair of glasses anymore.
So you had choice before the surgery to get a monofocal implant, which would have focused at only one distance, versus a multifocal implant that is going to focus at different distances. What made you choose the multifocal implant?
I didn't want to have to deal with reading glasses, which I felt I probably would. My husband and I like to bike, and so that was a convenience that I could see long distances, I could see close up, could see my speed, so if I was going too fast or had the potential to crash, I would know about it. So it was great, because I have crashed in the past wearing glasses, and took off the side of my frame and everything. So I was certainly aware of what I can and cannot see beforehand.
And that is nice. Most of our patients, they do have active lifestyles.
Yes, and it enables you to do so much. Our daughter has a boat, so we are able already this spring, have been out on the boat and not worrying about grabbing glasses or getting mist on them, or contacts, getting bugs in them, so in your eyes. So it's just freed me up. It's a great benefit.
Fantastic. Debbie, any other questions?
All the questions here.
Well, I've also recommended it to my brother. So he's 10 years younger than I, and he says, "Is that a benefit, getting old?" So you can have cataracts. I said, "Well, thanks. I don't know if I'd put it that way."
No, I've actually had patients, I talk to them about this lens and they say, "So what can I do to make my cataracts grow faster?" And I just start laughing. I'm like, "Really?" And they say, "Yeah, it's a big advantage to be able to use a smartphone and everything."
It is. And my husband is waiting. He's like on deck. He's like, "It's my turn now."
Well, that's excellent, and we appreciate it. And were you happy with the care you got at our center, at our office?
Yes, at the office, everyone has been so nice. And when we came the 2 mornings for the surgery, everyone was just so kind, and the girls in back were so helpful and patient with everybody, and it was a great experience. Woke up and I could almost see when I got home. So
excellent. Well, thank you so much. We appreciate your help with this. Thank you.
Both of you.